Hey everybody, Dr. Rob here, Facebook Live. Do you have the guts to be healthy? What have you done for your guts lately? So many patients, so many doctors have engaged me in a conversation of what's going on in your gut and the different issues between leaky gut, IBS, SIBO, celiac, Crohn's disease. So I'd like to go through a few of them and how it's critical that you ascertain which one you have, if any of them, and within that, what the proper nutritional protocol is, because it's going to change for the individual and it's also going to change per your condition. So let's talk about leaky gut. Leaky gut is such a big conversation. People go, my gut's leaky. So essentially we're talking about your intestinal tract. Leaky gut, a technical definition of leaky gut is hyperpermeability in the intestinal tract. Now your intestines are made up obviously of your small and large intestines. Your small intestine is about 20 feet. It has a pretty thin mucosal lining. So your small intestine is typically doing most of the work. As a matter of fact, your small intestine is where the most immune cells are in your body. The bulk of digestion is going on in your small intestine, and the bulk of what we call leaky gut can occur in the small intestine. The large intestine doesn't get as much options or opportunity for leaky gut because it doesn't do as much work, it's much smaller, and its mucosal lining is thicker. Leaky gut refers to the idea of specific nutrients and microbes that pass. So our guts are semi-permeable because things need to pass like nutrients and water. If nutrients and water were not able to pass through our gut and get into our bloodstream, we wouldn't be alive. We wouldn't have these nutrients. The problem with the gut when it becomes leaky is when the tight junctions open up just a little too much and bigger particles can pass that are not intended to pass, like proteins, microbes, and viruses. So when they pass what's not supposed to go through your gut and pass your gut and go into your bloodstream, you have the opportunity, unfortunately, to get something called autoimmunity. And what I mean by autoimmunity is your immunoglobulins immunoglobulins like IgA, IgM, and IgG. IgG being the biggest immunoglobulin, 75% of your immunoglobulins are IgG, and it actually passes the placenta. It grabs and you get an antigen antibody and you get an allergic reaction, you get autoimmunity. Autoimmunity is very deleterious to overall health because it can damage all these structures. So leaky gut is a critical element leading you down a path to prospective systemic diseases. That poses an issue. So we don't want leaky gut. That's what it means. People always say, well, it's leaking. Yes, it's leaky because the tight junctions, the things that hold it together, are a little too big and things pass through. In addition to leaky gut, you can get something called dysbiosis. Dysbiosis is an unleaveling of good and bad bacteria. We want good bacteria because the bacteria protects our gut. The bacteria enables us to send proper health signals throughout our body. So the good versus the bad bacteria, the ratio, shocking as it may seem, should be about 85% good bacteria to bad bacteria. Otherwise, we have this unleveling of good and bad bacteria. This unleveling of good and bad bacteria can lead us down a path of dysbiosis. Dysbiosis can produce something called LPS, lipopolysaccharide. Lipopolysaccharide holds what we call gram-negative bacteria on the inside of your intestinal tract. By holding this gram-negative bacteria on the inside of your intestinal tract, it's where it's supposed to be. If LPS is expressed because of dysbiosis and possibly leaky gut, gram-negative bacteria now gets to float around. Again, gram-negative bacteria can lead us down a path of some adverse conditions. LPS, when expressed lipopolysaccharide, is a systemic inflammatory marker damaging all sorts of different organs and organ systems. Thyroid, cartilage in the body, your brain, your musculoskeletal system, your liver, and the like. So we really want to have not an unleveling. We don't want dysbiosis. We want perfect synergy between the good and bad bacteria. So that covers this. Irritable bowel syndrome. Irritable bowel syndrome is you can't make your mind up if you have to go to the bathroom a lot or you can't go to the bathroom. So it's diarrhea versus constipation or on and off. IBS is pointed at the large intestine. So irritable bowel syndrome also poses an issue. It's very, very common. And yes, leaky gut can lead us to a path of getting IBS. Celiac disease, it means that you're allergic to the protein in gluten, gliadin, and gliadins. So you are, if you have celiac disease, allergic to the protein in gluten and the protein in wheat. Celiac disease occurs in the small intestine. Crohn's disease. Crohn's disease is an inflammation all the way from your mouth all the way down through your anus. Crohn's disease is one of the worst things you can conceivably have. As we break these down, and SIBO, small intestinal bacteria overgrowth, means that there's too much bacteria in your small intestine. Surprisingly enough, your small intestine should not have a lot of bacteria or residue of bacteria. But SIBO is when there's bacteria there. So typically what happens to get SIBO is the bacteria in your large intestine, where it typically populates, comes back and goes into your small intestine and stays there. Some of the things that lead you down a path of SIBO are, believe it or not, traumatic brain injury, anything that adversely affects your vagus nerve, and more commonly, your inability of what we call our ileocecal valve, which is a flap. It gets stuck, and therefore by getting stuck and not getting closed, the bacteria comes back into the small intestine. And then we have specific stomach acids, pancreatic acids, and bile acids that are decreased, leading you down a path of small intestinal bacteria overgrowth. So without question, you can clearly see that the small intestine would be circled, and that's where any of your functional nutrition, functional medicine practitioners, when we talk about gut health, should really emphasize. So everybody knows I do a 7R program. I have a book coming out at the end of this year where we talk a lot about the 7Rs and how to fix the gut. But the 7Rs don't pertain in the same light and to its totalitarianism, in that here's what you want to do for each of these. You want to break this down. So for leaky gut, the idea of leaky, every one of these, leaky, IBS, celiac, SIBO, what you want to do is you want to change somebody's diet. So no gluten, no processed food, no sugar, no dairy, no nicotine, no artificial sweeteners. That's just a starting point. Then in addition to that starting point, you want to find out what food allergies they have. Guaranteed, if you have any kind of food allergies, you're going to damage the intestinal lining, and you can lead you down a path of having 1, 2, 3, or 4. So it's always great. Everything is a baseline testing for food allergies. If you haven't had a test for food allergies and you get gas and bloating after you eat, that's something to consider. You should not get gas and bloating. If about a half hour, 45 minutes after you eat, you get a little brain fog, that shouldn't occur. That all leads you down a path that you may have a broken barrier, which we're going to touch. So for leaky gut, starting with always change somebody's diet. In addition to leaky gut, I'm a big proponent of using a probiotic, a good quality probiotic. Probiotics, genus, species, and strain. The strain is going to be specific. If you do some gut testing and you find out which bacteria you're more populated or underpopulated in, you can be very pinpoint specific. So leaky gut, I strongly recommend probiotics. Every one of these, in addition, digestive enzymes, protease, lipase, amylase, and specific enzymes like bromelain and pancreatic enzymes mixed together are going to help you with leaky gut. IBS, much more involved. IBS is probably going to take you a long period of time. IBS is probably going to imply that you may have some barrier breaking, which we're going to get to. Irritable bowel syndrome can take up to 6 to 12 months to heal. You're going to go through a full composite of the Magnificent Seven, the action steps. In that one, you're going to do a reset of your lifestyle. You're going to reset your lifestyle in that you're going to change what you eat. You're going to get a different mindset. You're probably going to go much more lower carbohydrate. The standard American diet leads us down a path of eating too many carbohydrates. So we want to remove those carbohydrates. And in that, you're going to change your diet, probably go a little bit more keto, if you will. So I would recommend some medium chain triglycerides over here, add some fiber, add some magnesium. Most Americans are deficient in magnesium. And you'll start with the first one, which is the reset. Then you're going to remove. So you're going to remove all the pathogens. When I say remove, that's when you detox. So I'm a big proponent of detoxing in phase 2. So you're going to detox because you want to detox all your chemicals. Where's the number one source of chemicals for most people? Believe it or not, they're in your mattress, because we sleep on mattresses that have flame retardants. Where's one of the largest amount of toxins in women? In the tampons that they use, because they're basically made out of cotton, which is a very, very sprayed item. In addition, coffee. Coffee is the third most sprayed item, and about 66% of Americans drink coffee. So you're getting a lot of toxins if you're not drinking organic coffee. So you want to remove with that IBS, and then you're going to remove with specific nutrients. These nutrients are great. You're going to use berberine, which takes out the lower bowel. You're also going to use oregano oil, which takes out all the bad bacteria from the upper bowel. You're going to use some garlic, which is a great antibiotic. In addition, you're going to use serum bovine immunoglobulins. Those serum bovine immunoglobulins are great because they're going to take out, and they're called the mop of the gut. So you're going to remove. Then the third one is you're going to replace. You're going to replace again with digestive enzymes. Number 4, a little change. Number 4 is going to be to regenerate or heal and seal the gut if the barrier is broken. If the barrier is broken, which we'll get to, you're going to heal and seal. If not, you're going to use specific nutrients like turmeric, ginger, boswellia, nag, okra, MSM to help heal the gut, but also create an anti-inflammatory environment in the gut. Fish oils have shown to be very, very effective because they actually help with receptor sites, and they dim inflammatory receptor sites in the gut. So you're now going to heal and seal and regenerate and repair the gut lining if need. At the very least, you're going to decrease the inflammation. Then you're going to reinoculate. You're going to reinoculate with good quality bacteria. Number 6, you're going to retest. So we always use a baseline, whether your baseline was just symptoms or the wonderful Cyrex test, which we're going to talk about in a few minutes. You're going to use a baseline, so you're going to test before and you're going to test after. Hopefully you've reached clinical outcome. Then you're going to do the 7R, which is to retain. In addition, the real question is, do you have a broken barrier? So what does that mean? Well, here's leaky gut. Here's a break in what we call the tight junctions, and here's a barrier break. So if the barrier is broken, you have a major problem, and if the barrier is broken, you have to do testing. How would you know that? Well, if zonulin and occludin are out, you're showing that there's a break in what we call the tight junctions. They're not just open, it's broken. If actomyosin is present, you could have a break now through the intestinal membrane. Breaks take about a year. I know that sounds like a long time. I apologize. It takes 12 months to heal, and that's when you're going to emphasize that 4th step, the heal and seal, to regenerate and repair the gut lining. So it's a little different. Leaky gut, IBS, and the question is, do you have a broken barrier? So like I said, when do you test? Well, I'm a big proponent of tests, so the tests I like are the Cyrex 2, Cyrex 3, Cyrex 4, and Cyrex 20. You want to test. There's some other great tests out there right now. In-office tests with a pinprick, KMBO does a great job with zonulin and occludin. Also, in addition, the protocols. What are you going to do? Real quick. Once again, GPS, no gluten, no processed food, no sugar, no dairy, no nicotine, no artificial sweeteners. You're going to test. You're going to change your lifestyle. You're going to adhere to the Super 7 action steps, the R's, so you can heal and seal all the damage and change whether you have leaky gut, IBS, celiac, SIBO. I saw you raise your hand. Did we have somebody?
You just have a shout out from Harrison Salisbury.
Hey, Harrison.
Keep up the good work, Doc. Thanks for all you do.
I appreciate that. Were there any questions? None. Okay, so there's a lot to synthesize here. So hopefully you guys will let me know. Let me know what you're thinking. Let me know if you can see the breakdown. And as a functional medicine doc, everything goes in the gut. Remember, 80% of your immune cells are in your gut. So start thinking when the patient comes in, whether you're a chiropractor, an exercise physiologist, a functional medicine doc, start looking at the gut and differentiating it. Dr. Rob, always yours in health.